Monkeypox is both a virus and a disease, and it's the virus that causes the disease, also called monkeypox. It's a member of the same family of viruses that causes smallpox, but it is a very separate disease from that. So it's a disease that is usually self-limited, meaning it will go away on its own. But some of the things that we worry about with monkeypox are the fact that the pox themselves, the pieces of the rash can scar. And then also there's rare cases where people have more serious infection affecting not just the skin, but also more important organs. Monkeypox is what we call a disease of close contact, meaning that you need to be close to someone, either to the lesions or to someone's breathing while they're infectious. And people can spread monkeypox from the first moment that they either notice a rash or get a fever or other kind of flu-like symptoms at the start of the disease, all the way through to when new skin grows up under the pox. So many of us remember when we were kids getting chickenpox, and you could go back to school when you had a scab over all of your chickenpox. That's not the case with monkeypox. The new skin actually has to grow up under that lesion. That said, people who are at risk of getting monkeypox are people who are not only sexual contacts, meaning people who've had sex with or had what we call intimate contact, to kind of broaden that definition of sex, but also people who share linens, who share bedding, who share sometimes a household with people who have monkeypox. A question I get asked all the time is monkeypox a gay disease? And the answer is no. Monkeypox is not a gay disease. Monkeypox is a disease that is happening to gay people. Monkeypox is a disease of close contact, so it's going to spread through sexual and social networks. Currently in the United States, it is predominantly spreading through the sexual and social network of men who have sex with men. As we all know, no sexual network is closed, and eventually we will see monkeypox move outside of predominantly affecting gay men and will affect the larger population if we don't do anything to prevent it now. It's a disease of close contact. And that means that we will expect household contacts of people with monkeypox to get monkeypox at a certain rate. It also means that a child who gets monkeypox is not by definition a victim of sexual abuse or rape or anything else. It doesn't indicate anything wrong happened other than the fact that they were in close contact, sharing a household or with a caregiver who had monkeypox disease. So what are the symptoms of monkeypox? Monkeypox is classically, meaning the way the textbooks were written, starts with what we call a viral prodrome. This is an influenza-like illness. So you might feel fever, fatigue, headaches. Then a day or two later, you'll start to get the classic rash. Classically, the rash starts in the mouth, then goes to the face, the hands, and the extremities. However, in the current monkeypox epidemic, we're seeing something very different. We're seeing people who may not have any prodrome, meaning no fever, no fatigue, nothing like that, and who just have the pox. We're also seeing people who have the pox first and then the fever. We're seeing the pox start anywhere in the body, including just one or two areas in the genital or perianal area. All of this is new for monkeypox and is very specific to this. We're also seeing occasional people who just have proctitis, meaning rectal pain or bleeding. So these symptoms are different, and we want you to have a high, what we call index of suspicion, meaning if you're concerned about monkeypox, if it crosses your mind, go get checked out. If you're worried that you've been exposed to monkeypox, the first thing to do is to go within the first 14 days, and the earlier the better, to go and get vaccinated as post-exposure prophylaxis. So let's say that you have an exposure on Saturday. On Monday morning, I want you on the phone trying to get a vaccine. The earlier we do this, the more likely we are to be able to avoid you getting monkeypox. If you've been exposed and you start to feel sick, you no longer qualify for vaccine, and in that case we want you to go in and get tested for monkeypox. When you go in and get tested, you can go to your primary care doctor, you can come to the STD clinic, you can come here to Toland Park. Just let us know that you're coming for monkeypox testing so we can be ready for you. You should definitely isolate if you start to have symptoms of monkeypox, but there's no need to isolate before you have symptoms. So monkeypox is not normally treated. Most people will get better on their own from monkeypox, meaning monkeypox is a self-limiting illness. However, there are certain groups of people who will need treatment, and that's people who have immunosuppression, so things like advanced HIV, or people who are on cancer or other immunosuppressive drugs, young children under 8 years old, pregnant breastfeeding women, and then people with certain skin conditions like psoriasis or eczema would need to be treated for monkeypox because they're at risk of getting more serious disease. For other people who don't fall into those categories, treatment is available if you have uncontrolled pain, if you have lesions in sensitive areas, or if you have evidence that your disease is maybe worse than we would hope it to be. That treatment is called tecovirimat, or TPOXX. This is an antiviral medication that is approved by the FDA for the treatment of smallpox and for complications of smallpox vaccination, but is under something called an EUA IND for monkeypox. That means that we are trying to walk a fine line between making sure that everybody who might benefit from this treatment has it available, while recognizing that we don't have all of the data yet that suggests that it's effective. Our anecdotal data suggests that it is effective and safe, and we have decent safety data, but we're trying to walk that fine balance between not withholding a potentially beneficial medication, but also not telling people that this medicine is more advanced in its regulatory process than it is. How to get the vaccine, I will be very frank with everybody right now, is an evolving situation. We are working actively with both the Michigan Department of Health and Human Services and the Detroit Health Department to expand access to the vaccine at more locations. Right now, there are two ways to get the vaccine. You can either call or walk in to the City of Detroit Vaccine Clinic, and that's at the Detroit Health Department, or you can call the Detroit Health Department STD HIV Clinic / Toland Park vaccine line and make an appointment with us. The number for the Toland Park and STD Clinic vaccine clinics is 313-577-9080. That's 313-577-9080. That number will take you to a voicemail. Leave a message with your name and a good contact number to reach you at, and someone will get back to you either at noon if you call in the morning, or late in the afternoon if you call after 12 noon, and schedule you for the next available vaccine appointment. So what does getting vaccinated look like? The vaccine dose has changed. So everybody in the United States is using Jynneos vaccine. This is a non-replicating vaccine strain, meaning it's completely safe and been tested in people who have all kinds of immunosuppression, including advanced HIV and pregnant and breastfeeding women, and it is safe in all of those populations. There is no lower age limit on vaccination, meaning you can bring a baby all the way down to neonate in to be vaccinated, and it would be safe for them. Similarly, there's no upper age limit. You can be as old as you are alive and get vaccinated against monkeypox. What we have done, because our vaccine supply is very limited, is used the data from a really important study that showed that when we give the vaccine into the skin, meaning intradermal, it has the same efficacy as giving the dose subcutaneously, meaning right under the skin. And so with that, we're able to split each vial into 5 doses, meaning that for every 1 prior dose, we can now vaccinate 5 people. This has allowed us across the country to go back to a 2-dose vaccine strategy. Before, when we were using just the subcutaneous, in order to get vaccine to as many people as possible, we were telling folks, wait, we'll do your second dose of the 2-dose series at some undisclosed time in the future. Because we're doing this with the intradermal route, we're able to use less vaccine and thus get back to a 2-dose strategy across the country. So everybody who's going to get vaccinated with this 2-dose strain, with this intradermal mechanism, is now going to get the 2 doses. Everybody who got vaccinated previously will also get 2 doses, but it means we'll be able to complete everybody's dose schedule and vaccinate many, many more people without losing any efficacy of the vaccine. The intradermal dosing does have a couple of caveats, though, meaning a couple of warnings. The first is that it goes on your forearm rather than on your shoulder. And some people are reporting that it does have a little bit of increased pain. That said, it's not as bad as a tetanus shot, is the word on the street. So I want to reassure you that though it is a little bit worse, we're still deeply in the category of not that bad. The other thing about it is that if you are someone who has a history of keloid formation, this dosing strategy might not be for you. And we want you to talk to your vaccinator about whether or not you have keloids or other significant skin diseases before we give you an intradermal dose. The easy answer about when you reach protection from monkeypox after you get vaccinated is 2 weeks after your second shot. What we don't know is how much protection you have after just 1 dose, and we'll find out about that. The one thing I want to make sure everyone understands is that because we are using these vaccines mostly as what we call post-exposure prophylaxis, there will be some people who go on to develop monkeypox after their first shot. And that's not a sign that the vaccine didn't work. That's simply a sign that their infection had already started at the time that they got the vaccine. So if you develop monkeypox in between your first and second shot, that's a sign that you probably already had monkeypox when you got your first shot.